Welcome to Indian Anatomist. Today's topic is nasal septum. Nose is part of the respiratory system. It allows air to enter the body, then filters debris and warms and moistens the air. The nose gives us our sense of smell. The nose also plays an important role in facial appearance. Morphologically, nose is divided into external and internal nose. External nose, pyramidal in shape, projects forwards in the face. Roughly, the external nose has root of the nose, tip of the nose, and dorsum or bridge of the nose. Inferior surface of external nose contains two piriform or pear-shaped openings called nares or nostrils or anterior nasal apertures. Above the nares, the dilated part of the nose is called vestibule that is bounded externally by alae wings of the nose. Dear medicos, please view the example below of the bulged ala or flaring nostril, which may have occurred during anger. Like anterior nasal aperture, each nasal cavity has oblong or oval-shaped posterior nasal aperture, also called as choana, situated between the internal nose and nasopharynx. The choanae are separated by posterior part of the nasal septum by vomer bone. Vestibule of the nose, a part of internal nose, is lined by the stratified squamous epithelium that comes from exterior of the nose. Stiff hairs seen in the vestibule are called vibrissae. As a result of the airflow that happens while breathing, these vibrissae pulsate. These hairs in the nasal cavity act as a selective filter, keeping dust and insects out of the airway. Now coming to the components of nose. From above downwards, it is made of bone, cartilage and skin that forms an envelope for the external nose. For the purpose of studying, the nose is divided into two nasal cavities that are entirely covered by mucous membrane, lined by pseudostratified ciliated columnar epithelium except vestibule lined by stratified squamous epithelium, and near the roof lined by special neuroepithelium, the olfactory epithelium, for smelling. Each nasal cavity has a roof, floor, lateral, and medial walls. Medial wall of nose, also called as septum of nose, which is common to both the nasal cavity. See the illustrations on left side. The nasal shape in the coronal section of a dissected specimen and skull is shown above and below, respectively. For each nasal cavity. Roof, 7 cm long and 2 mm wide in anteroposterior direction. For easy understanding, the roof is divided into three parts from anterior to posterior, are frontonasal part anteriorly, ethmoidal part in middle and posteriorly bisphenoidal part. The respective bones are taking part in roof formation. Now coming to the floor of each nasal cavity. The floor is approximately 5 cm long and 1.5 cm wide. It is formed anteriorly by palatine process of maxillary bone and posteriorly by horizontal plate of palatine bone. Medicos, refer to the illustrations. Two images of the skull at nose level illustrate the anterior and posterior nasal openings. Below, 3 images showing the dissection specimens of face from anterior to posterior. Dear medicos, first, we shall explore the septum or medial wall of the nose. As I previously stated, the septum of the nose defines the medial boundary for both nasal cavities. The septum has bones, cartilage, and skin like the rest of the nose. On both the right and left sides, there is a mucus layer covering the bones and cartilages of the septum. Now, what are the bones forming the nasal septum? Number 1 is perpendicular plate of ethmoid bone lies in anterosuperior aspect of septum. Number 2 is vomer, present on postero-inferior aspect of septum. Finally, some contributions from nasal crest of maxilla and palatine bones. Now coming to the cartilage of nasal septum. There is only one cartilage visible in the septum. It is the nasal septal cartilage that articulates with the margins of the bony septum behind, and the lateral nasal cartilages in front, which are a component of the lateral wall of the nose. Lastly, the cuticular or skin covering portion. It encompasses the entire external nose, including the septum. The antero-inferior portion is referred to as the columella. The columella is the central fleshy portion that is situated between the two nostrils, nares, or anterior nasal apertures. It is primarily composed of fibrofatty tissues that are concealed by the skin. Now coming to the blood and nerve supply of nasal septum. Blood supply-wise, the nasal septum is divided into 4 quadrants. They are anterosuperior, anteroinferior, posterosuperior, and posteroinferior. The anterosuperior quadrant of septum is supplied by anterior ethmoidal artery, is a branch of ophthalmic artery, a branch of internal carotid artery. The anteroinferior quadrant is supplied by superior labial artery, branch of facial artery, which is a branch of external carotid artery. The posterosuperior quadrant of septum is supplied by posterior ethmoidal artery, is a branch of ophthalmic artery, a branch of internal carotid artery. Whereas the posteroinferior quadrant of septum is supplied by sphenopalatine artery, is a branch from maxillary artery, which is a branch of external carotid artery. Ultimately, the septum is supplied by arteries of both external and internal carotid arteries. Now it's time to talk about the nerve supply of the nasal septum, including the mucous membrane. For nerve supply, the nasal septum is divided into 4 quadrants, similar to blood supply. 1. Nearer the roof, the septum is supplied by olfactory nerves. 2. Anterosuperior quadrant, supplied by anterior ethmoidal nerve, branch of nasociliary nerve, from ophthalmic division of trigeminal nerve. 3. Anteroinferior quadrant, supplied by anterior superior alveolar nerve, branch of infraorbital nerve, from maxillary division of trigeminal nerve. Finally, the posterosuperior and posteroinferior quadrants are innervated by the posterior superior nasal and nasal branches, respectively, from the nasopalatine nerves. These nerves arise from the sphenopalatine ganglion. Dear medicos, we have thoroughly examined the anatomical characteristics of the nose, including its septum, as well as its blood and nerve supply. Now, let us go into the clinical anatomy of the nasal septum. Number 1 is Kieselbach's or Little's area. The nasal septum is a common site of nose bleeding, medically called as epistaxis. All of the arteries in the nasal septum come together here on the anterior inferior aspect of the septum. This creates a Kieselbach's arterial plexus or anastomosis of nose. Due to this anastomosis, even a small cut, an illness, an allergy, a drug that thins the blood, recreational drugs like cocaine, chemical irritants, or being at a high altitude can make your nose bleed a lot. Number 2 is deviation of nasal septum. The septum of the nose is usually a little off to the right or left, making one of the nasal cavities a little bigger than the other. If the septum deviates out of place because of an accident or trauma to the nose, or even if there are no symptoms, surgery could be used to fix the problem. Dear medicos, the lecture on the nasal septum has concluded. Although it may seem small, this topic holds great clinical significance. If you have any inquiries or concerns, kindly post them in the comment box. We'll catch up with you in the next video. Keep watching and subscribing to Indian Anatomist, my YouTube channel. Have a nice day, everyone.